The scalpel slipped. Instructor Gareth Thorne watched the blade slice through the glove of Cadet Jensen Kael and into the flesh beneath. Blood welled immediately, bright red and flowing faster than it should. The cut was deep. Possibly tendon damage. Definitely requiring immediate medical intervention. Around the emergency medical training laboratory, 47 students from 17 different species froze in various states of shock. They were in week 6 of the Galactic Emergency Response Certification Program, and this was supposed to be a routine surgical simulation using synthetic materials. No one had anticipated a real injury. "Stay calm," Gareth said immediately, his voice cutting through the rising panic. He moved toward Jensen with practiced efficiency while simultaneously assessing the situation. The cut was on the left hand between the thumb and index finger. Severed digital artery. Blood loss would become critical within minutes without intervention. Jensen looked at his hand with surprising calm. "Well, this is embarrassing. Sorry, Instructor Thorne. I must have positioned the stabilization clamp incorrectly. Save the apologies for later," Gareth replied. "Right now, we are going to demonstrate practical trauma response. Everyone, gather around. This is the most valuable lesson you will receive in this entire course." "We should call medical personnel," protested Valimna, a Cytherian student whose translucent body pulsed with colors indicating extreme distress. "He is bleeding. He needs professional care immediately." "He is receiving professional care," Gareth corrected. "I am a certified trauma surgeon. And more importantly, this is exactly the kind of injury you will need to treat in the field where professional medical facilities are not available. So pay attention." He guided Jensen to a chair and elevated his hand above heart level. Blood continued to flow, but the elevation slowed the bleeding marginally. "First principle of trauma care," Gareth announced. "Control the bleeding. Everything else is secondary. If your patient bleeds out, nothing else you do matters." He grabbed a clean towel and pressed it firmly against Jensen's wound. The pressure was considerable, enough to make most species cry out in pain. Jensen winced but made no sound beyond a sharp intake of breath. "Direct pressure is your primary tool," Gareth continued. "Apply firm, constant pressure to the wound site. Not gentle pressure. Firm. You are trying to mechanically compress blood vessels to slow blood loss. It will hurt the patient. That is acceptable. Pain is temporary. Death is permanent." Several alien students made sounds of distress. Kilnith, a Morphirian whose species felt empathic pain when witnessing suffering, actually swayed on his multiple legs. "Instructor Thorne, surely there are less painful methods," Kilnith managed. "Our medical protocols emphasize minimizing patient discomfort. Your medical protocols are designed for species that evolved on worlds where injuries are rare and easily treated," Gareth replied bluntly. "Humans evolved on a Class 12 death world. Injuries are constant. Pain tolerance is survival requirement. We treat injuries differently because our biology requires it. Now watch closely. I am going to demonstrate field arterial compression." He removed the blood-soaked towel and examined the wound. The bleeding had slowed but not stopped. With practiced precision, he located the pressure point in Jensen's wrist where the radial artery could be compressed against bone. "The human cardiovascular system operates at higher pressure than most species," Gareth explained while maintaining firm pressure on the artery. "Our hearts generate approximately 120 millimeters of mercury pressure at rest. Under stress, much higher. This means we bleed faster and more profusely than you do. It also means we can survive blood loss that would kill other species." He glanced at Jensen. "How are you feeling, Cadet?" "Honestly? Like an idiot who ruined a perfectly good training session," Jensen replied. "But physically, I am stable. Maybe a bit lightheaded." "Lightheaded is normal," Gareth confirmed. "You have lost approximately 200 milliliters of blood in the past 90 seconds. That is less than 5% of your total blood volume. Uncomfortable but not dangerous. A human can lose up to 15% of blood volume and remain conscious and functional. Beyond that, shock becomes a concern." 200 milliliters in 90 seconds would kill most of us, gasped Trainix, a Valinor student whose species had evolved in low-gravity environments with delicate circulatory systems. How are you so calm about this? Because panic kills more people than injuries do, Gareth replied. Fear causes people to make poor decisions. I am not afraid because I have seen far worse injuries survive with proper treatment. This is actually relatively minor by Deathworld standards. He addressed Jensen again. I am going to pack the wound now. This will hurt considerably. Breathe through it. Understood, Instructor. Gareth released the arterial pressure point and quickly packed the wound with sterile gauze, forcing the material deep into the cut to create mechanical pressure from within. Jensen's face went pale and sweat beaded on his forehead, but he maintained his composure. The alien students watched in horrified fascination as Gareth essentially stuffed fabric into an open wound. What are you doing? Valimna nearly shrieked. That is barbaric. You are causing intentional trauma to injured tissue. I am preventing him from bleeding to death, Gareth corrected. Deathworld first aid is not about comfort. It is about survival. The wound packing creates internal pressure that mechanically compresses damaged blood vessels. It hurts, yes. But it works. And working is more important than comfortable. He wrapped the packed wound tightly with additional bandaging, maintaining constant pressure. The bleeding stopped almost immediately. Secondary principle of trauma care, Gareth continued. Once bleeding is controlled, assess for complications. Jensen, any numbness or tingling in your fingers? No, sir. Full sensation. Can you move your thumb? Jensen demonstrated functional movement. Range is limited by pain, but motor control seems intact. Good. Probably did not sever the tendon. You are lucky. Lucky is not the word I would use, sir. Gareth almost smiled. Fair point. But you are fortunate the injury is not worse. I have seen similar accidents result in complete loss of finger function. Now, class, observe the patient. What do you notice about his condition? The students stared at Jensen, who sat calmly despite having experienced what most of them would consider catastrophic trauma. He is not unconscious, Trainix said slowly. How is he not unconscious? That much blood loss should have triggered protective shock in any sensible species. Humans do not go into shock as easily as other species, Gareth explained. Our nervous systems are designed to keep us functional through significant trauma. This is an evolutionary adaptation from surviving on a planet where predators, environmental hazards, and simple accidents could cause serious injury daily. If we passed out every time we got hurt, we would have gone extinct. But the pain, Kilneth said, his empathic distress obvious. I can feel his pain from here. How is he tolerating it? Training in biology, Jensen answered before Gareth could respond. Human pain tolerance is higher than most species because we experience pain more frequently. Our nervous systems adapt. And we learn through childhood to function despite pain because on Earth, letting pain stop you can mean death. This is horrifying, Valimna whispered. This is survival, Gareth corrected. And it is what makes humans valuable in emergency response situations. We can treat injuries that would incapacitate other species. We can function under conditions that would overwhelm most medical personnel. We can make decisions while experiencing significant pain or injury ourselves. That is why humans are often requested for high-risk rescue operations. He began cleaning the blood from Jensen's arm with efficient movements. Now let me show you something else that will probably disturb you. I am going to administer a local anesthetic and suture this wound closed. Here. In the field. Without sterilized surgical facilities. That cannot be safe, Trainix protested. It is not optimal, Gareth agreed. But it is safe enough. The human immune system is extraordinarily robust compared to most species. We evolved resistance to thousands of pathogens because Earth is essentially a planet-wide infection vector. Our bodies can fight off bacterial and viral loads that would kill other species within hours. This means we can perform field surgery with relatively low risk of deadly infection. He prepared a syringe with local anesthetic. This is going to sting, Jensen. The injection itself will hurt worse than the wound does right now. Understood, sir. Gareth injected the anesthetic directly into the wound edges. Jensen's jaw clenched and his breathing hitched, but he remained motionless. Why does the pain relief cause pain? Asked Selthera, a reptilian cortex student who had been watching with intense focus. Because I am injecting fluid into damaged tissue that is already swollen and inflamed, Gareth explained. The pressure causes additional pain before the anesthetic takes effect. It is unavoidable. But in approximately 30 seconds, the area will be numb and I can suture without causing further discomfort. He waited the appropriate time, tested Jensen's sensation, and then began to suture. The students watched as Gareth used a curved needle to pierce skin, draw it through, and tie knots that pulled the wound edges together. Several students turned away or made sounds of distress. This is standard medical procedure, Gareth said calmly while working. I am surprised by your reactions. Do your species not use sutures? We use tissue bonding, Belimna said. Or cellular regeneration stimulation. Or biosynthetic patches. We do not pierce healthy tissue with metal implements and draw thread through it. Your methods require sophisticated medical equipment, Gareth pointed out. Sutures require a needle and thread. They work in any environment. They can be improvised from available materials. They are the most universally applicable wound closure technique ever developed. Humans learned to suture wounds over 2,000 years ago, long before we had advanced medical technology. It kept us alive then. It keeps us alive now. He completed the suturing with practiced efficiency. 14 stitches total. The wound was now cleanly closed, no longer bleeding, and showing no signs of immediate complication. There, Gareth said. Field trauma care complete. Jensen, you need proper medical evaluation to check for nerve damage and to receive prophylactic antibiotics. But you are stable, the bleeding is controlled, and the wound is closed. In an actual emergency situation far from medical facilities, this intervention would be sufficient to prevent death or permanent disability. Jensen examined his bandaged hand. Thank you, Instructor Thorne. And I apologize again for the disruption. The disruption provided the most valuable training this class will receive, Gareth replied. He turned to address all the students. What you just witnessed is Deathworld medicine. It is brutal by your standards. It causes pain. It is performed with minimal equipment. It is not gentle or comfortable. But it works. And in emergency situations where lives are at stake, working is the only thing that matters. But humans are so fragile. Trainix burst out. Your bodies are easily damaged. You bleed profusely. You experience severe pain from injuries. How can you be valuable in emergency situations when your own species is so vulnerable? That is exactly why we are valuable, Gareth replied. Because we are fragile, we learn how to treat fragility. Because we bleed easily, we learn how to stop bleeding. Because we experience severe pain, we learn how to function despite pain. Every weakness of the human body became a lesson in how to overcome that weakness. We are not the strongest species. We are not the most durable species. But we are the species that learn how to survive despite being weak and vulnerable. He gestured to Jensen. This cadet experienced an injury that would hospitalize most of you for weeks. He will be back in class tomorrow with nothing more than a bandage and probably an amusing story about the time he stabbed himself during training. That is not because humans are tough. It is because we have spent millions of years learning how to treat injuries that would kill tougher species simply because those species never needed to develop the medical knowledge we required to survive. Selthera spoke thoughtfully. You are saying that human medicine is advanced specifically because human bodies are so prone to damage? Exactly, Gareth confirmed. Our vulnerability became our expertise. We study trauma care because we experience trauma constantly. We develop pain management because we experience pain frequently. We perfected field medicine because we often needed medical care far from hospitals. Every limitation of our biology drove us to develop solutions. That is the Deathworld advantage. We learned to turn our weaknesses into strengths. I think I understand now, Selthra continued. When we call for human emergency responders, we are not requesting them despite their fragile biology. We are requesting them because their fragile biology taught them skills we never needed to develop. Correct, Gareth said. A Cytherian medical technician has sophisticated equipment and extensive knowledge of Cytherian physiology. But if that equipment fails or the patient is not Cytherian, they are limited. A human medic has knowledge that works with minimal equipment across multiple species. We learned to improvise because we had to. We learned to work with limited resources because Earth rarely provided ideal conditions. We learned to treat the injured while injured ourselves because on a death world, the rescuer is often as damaged as the person needing rescue. He paused, letting that sink in. That is what I am teaching you. Not human medicine specifically. Universal principles of trauma care that work regardless of species, equipment, or conditions. Today you learn that controlling bleeding is the priority. That pain is acceptable if it prevents death. That field medicine is about survival, not comfort. These are lessons humans learned through millions of years of getting injured on a planet that did not care whether we survived. Now you are learning them too? Over the following hour, Gareth sent Jensen to the medical center for evaluation while continuing to use the incident as a teaching moment. He demonstrated proper bandaging techniques. He explained the physiology of shock and how to recognize it across different species. He discussed the psychological aspects of treating trauma, staying calm, projecting confidence, and making quick decisions under pressure. The alien students were attentive in a way they had not been during previous lectures. They had witnessed something that transformed abstract concepts into concrete reality. They had seen a human experience what most of them considered a catastrophic injury, and watched him walk out of the classroom under his own power, joking with his instructor. I have a question, Belimna said near the end of the class. If humans are so accustomed to injury and pain, why do you become medical personnel? Why dedicate your life to treating others when you are so capable of treating yourselves? Gareth considered the question. Because capability does not eliminate suffering. Just because humans can survive terrible injuries does not mean we should have to. Just because we can function through pain does not mean we should endure it unnecessarily. Human medicine exists not because we cannot survive without it, but because we believe survival is not enough. We want people to live without pain, to recover fully from injuries, to thrive, not just exist. That is why I teach. Not to make you tough like humans, but to give you the knowledge that helps the fragile survive. Even though we are not from death worlds? Kilnith asked. Especially because you are not from death worlds, Gareth replied. You never needed to learn these skills. Your worlds were gentle enough that you survived without brutal medical interventions. But the galaxy is not gentle. Space is not kind. Emergencies happen regardless of what planet you evolved on. So you need to learn what Deathworlders know. Not to become like us, but to ensure that when disaster strikes, you can help those who need it. Even if helping requires doing things that seem horrifying to you. The class ended with a new understanding. The alien students had enrolled in the program believing emergency medicine was about knowledge and equipment. Now they understood it was also about mindset. About willingness to cause pain to prevent death. About functioning despite fear and distress. About making hard decisions quickly. About being willing to do what Deathworlders did every day, survive despite the odds. 3 days later, Gareth received a report on Jensen's condition. The wound had required minimal medical intervention beyond cleaning and updated dressings. No nerve damage. No tendon involvement. No infection. Complete healing expected within 2 weeks. Exactly as Gareth had predicted based on his field assessment. He was reviewing the incident for his official report when Belimna requested a meeting. The Cytherian student entered his office with hesitant movements, her translucent body displaying colors that indicated anxiety and determination in equal measure. "Instructor Thorne, I need to apologize," the Limna said. "For what?" "For calling your methods barbaric. For questioning your treatment. For not understanding what you were teaching us." She pulsed through several color shifts. "I have been researching human medical history since the incident. What you did in that classroom, the direct pressure, the wound packing, the suturing, that is actually remarkably advanced compared to what my species does in similar situations." "How so?" Gareth asked. "We rely on technology," the Limna explained. "If our medical equipment fails or is unavailable, we have very limited treatment options. But humans developed effective treatments using minimal technology. You can stop bleeding with cloth and pressure. You can close wounds with needle and thread. You can prevent infection with simple cleanliness protocols. Your medicine works without sophisticated equipment because it was designed to work without sophisticated equipment." She pulsed a color Gareth had learned indicated respect. "We call Earth a death world as an insult. As if surviving there was somehow shameful. But I realize now that it was Earth's hostility that forced humans to develop knowledge we desperately need. When I respond to emergencies in the field, I will have equipment. But equipment fails. Technology breaks. And when that happens, I need to know what you know. How to save lives with nothing but knowledge and determination. That is what I am trying to teach," Gareth said. "I am glad you understand. I have one more question," the Limna added. "When Jensen cut his hand, you were completely calm. No fear. No panic. No hesitation. How? How do you remain so composed when facing injury and blood and pain?" Gareth was quiet for a moment. "Because I have seen worse. Much worse. I served as a trauma surgeon on Earth for 15 years before coming to teach. I treated accident victims, crime victims, and people who were simply in the wrong place when disaster struck. I learned that panic helps no one. That fear wastes time people might not have. That the only way to save lives is to suppress your emotional response and focus entirely on the problem. It is not easy. It is not natural. But it is necessary." "That must be difficult," the Limna said softly. "It is," Gareth admitted. "But it is also why human medical personnel are effective. We learn to separate our emotions from our actions. We feel the fear and the distress, but we do not let those feelings control us. We act despite them. That is another death world lesson. Emotions are information, not commands. Fear tells you there is danger, but it does not force you to run. Pain tells you there is injury, but it does not require you to stop. Humans learn to acknowledge our feelings and then do what needs to be done regardless." The Limna's colors shifted to something Gareth did not have vocabulary for. "I want to learn that. Not just the medical techniques. The mindset. The ability to function despite fear. Can you teach that?" "I am trying to," Gareth said. "Every lesson. Every demonstration. Every time I show you something that disturbs you and ask you to do it anyway. That is teaching you to function despite discomfort. To act despite fear. To help despite the emotional cost. Those are the real skills of emergency medicine. The technical knowledge is secondary." "I understand now," the Limna said. "When you had us practice suturing on synthetic tissue last week and I said it felt wrong to pierce the material with needles, you told me to do it anyway. You were teaching me to overcome my instinctive aversion." "Exactly. Your instincts evolved for a gentle world where piercing tissue is harmful. But in trauma care, piercing tissue can be necessary. You need to override your instincts with your intellect. That is hard. But it is learnable." The Limna pulsed with determination. "Then I will learn it. I will master human techniques even if they feel wrong to my instincts. Because you are right. Working is more important than comfortable. And saving lives matters more than my emotional discomfort. That is the right attitude," Gareth said. "And that is why I believe you will become an excellent emergency responder. Not despite being from a gentle world, but because you are willing to learn what Deathworlders know. 6 months later, Gareth received a report from the field. One of his former students, Valimna, had responded to a shuttle crash on a remote station. Multiple casualties. Limited medical equipment. The station's primary medical facility was damaged in the crash. Valimna had used direct pressure to control arterial bleeding on a Terralian engineer. She had performed field wound packing on a Morphirian crew member. She had sutured lacerations on 3 different patients using improvised materials when sterile supplies ran out. She had triaged efficiently, prioritizing critical cases while providing basic care to less severe injuries. All 7 casualties survived. The report specifically noted that traditional medical approaches would have resulted in at least 3 fatalities due to blood loss before advanced care could be provided. But Valimna had applied Deathworld medical techniques and kept everyone alive long enough for proper treatment. The final line of the report made Gareth smile. Recommend commendation for medical responder Valimna. She performed with the calm efficiency and improvisational skill typically associated with human medical personnel. Her training in Deathworld emergency medicine saved lives that would have been lost using conventional protocols. Gareth filed the report in his growing collection of success stories. Students from gentle worlds learning hard lessons. Students who overcame their instinctive revulsion to painful treatments because they understood that pain was temporary but death was permanent. Students who learned that human weakness had taught humans how to help the weak survive. That evening, he taught another class. Another group of alien students encountering Deathworld medicine for the first time. He demonstrated wound cleaning, a process that required scrubbing injured tissue with antiseptic solutions. The students watched in horror as he explained that removing contaminated material was more important than avoiding additional pain. "This seems cruel," one student said. "It seems cruel because you evolved on worlds where gentleness was sufficient," Gareth replied. "But Earth taught us that survival requires uncomfortable interventions. That helping sometimes means hurting. That the rescuer must be willing to cause pain to prevent death. These are hard lessons. But they are necessary lessons. Because the galaxy is not always gentle. And when disaster strikes, someone needs to know what Deathworlders know." He paused and looked at each student in turn. "I am teaching you to be that someone. Not to make you into humans, but to give you the tools humans developed through millions of years of surviving a hostile world. When you complete this program, you will carry knowledge that can save lives across the galaxy. Knowledge that only exists because Earth was harsh enough to require it. That is the gift Deathworlders offer. Not our toughness. Not our pain tolerance. But our understanding of what it takes to survive when survival seems impossible. And that understanding," Gareth continued, "is worth more than any sophisticated medical technology. Because technology fails. Equipment breaks. Supplies run out. But knowledge persists. And the knowledge I am teaching you will work anywhere, on any species, with minimal resources. That is what makes it valuable. That is what makes it worth learning, even when it disturbs you." He picked up a suture kit. "Now let us practice closing wounds. I promise, it gets easier with repetition. The first time is always the hardest. But by the 100th time, your hands will move automatically and your mind will be free to focus on the patient instead of your own discomfort. That is mastery. And that is what we are working toward." The class practiced. Some students struggled with the unfamiliar techniques. Others adapted quickly. All of them persevered despite discomfort because they understood what was at stake. They were learning to be emergency responders. Not just any responders, but the kind who could function when everything went wrong. When equipment failed. When supplies were exhausted. When the injured outnumbered the caregivers. When conventional medicine was impossible. They were learning to be the kind of responders who saved lives despite impossible odds. They were learning to think like Deathworlders. And across the galaxy, people who would someday face disasters not yet imagined would survive because these students chose to learn what humans knew about surviving the unsurvivable. That, Gareth reflected, was worth every uncomfortable lesson. Worth every horrified reaction. Worth every moment of teaching aliens that sometimes, the most compassionate thing you can do is cause temporary pain to prevent permanent death. That was the lesson of Earth. And now, it was the lesson of the galaxy. If you enjoyed this story, like the video and subscribe for more.